Welcome and good afternoon. Today is Tuesday, March 7th. I hereby call the Insurance Subcommittee to order. Madam Secretary, please call the roll.
Representatives Capley, Sapicki, Himmer, Hicks, Kumar, Lafferty, Martin, Mitchell, Rudd, Rudder, Terry, Chairman Haynes.
Here.
Chairman Haynes, you have a quorum.
Thank you. Before we get started, do we have any personal orders? Seeing none, we have 9 bills on the calendar this week. First up is item number 1, House Bill 493 by Chairman Johnson. We have a proper motion and a second. Chairman, you have an amendment. Would you like to verify?
Yes,
the
ma'am, I
drafting code?
do. And the code is 4391.
We have a proper motion and second on the amendment. Your amendment rewrites the bill. Would you like to go ahead and put that on the bill?
Yes, ma'am.
Okay, we are voting on the amendment. All those in favor of the amendment signify by saying aye. Opposed? The ayes have it. The amendment is on the bill. Chairman, you're recognized.
Thank you, Madam Chairman. House Bill 493 extends the annual nursing home bed assessment until June 30th of 2024. This bill is amended, also reduces the assessment on non-Medicaid facilities and private pay buildings. And the facilities that receive the significant reimbursement from Medicaid will see an increase in rate to help set off to offset wage and other inflationary pressures.
Thank you for that
I'm
explanation.
open for any questions.
Any questions from the members? Seeing none, all those in favor of sending House Bill 493 to insurance full signify by saying aye. Aye. Opposed? Ayes have it. Bill goes to insurance full.
Thank you, Madam Chairman. Committee.
Item number 2 is House Bill 1503 by Chairman Vaughn. We have a motion and a second? Thank you. I see you have an amendment. Do you want to verify your drafting code?
Yes, Madam Chair, it's Amendment 4950.
Do we have a motion and second on the amendment? Chairman, your amendment makes the bill, so we're going to vote on the amendment. All those in favor signify by saying aye. Opposed? Ayes have it. The amendment is on the bill. Chairman, you're recognized on the bill as amended.
Thank you, Madam Chairman. As you may recall, we had testimony last week in here, but we had not gotten an amendment filed, which took care of some things. Just as a recap on the bill, it holds patients harmless in surprise billing situations. It establishes an independent dispute resolution process for payers and providers to work through out-of-network services at in-network facilities. Again, I was telling you about the riveting story about my son's pitching hand. And then it creates greater oversight of network adequacy standards by the Commerce and Insurance Department. Here's what we did with the amendment since the last time we were together. At the request of TennCare, they were clearly removed from the bill. It was never the intention that they be included. Cleans up some of the sections regarding the arbitration fees and what happens when a party defaults. Ambulance providers were exempted from the bill. Revised the effective date to go into January 1st of 2024. That allows additional rulemaking time. It clarifies that the department can utilize an independent claims database if the all claims database isn't funded in the budget. And it gives them rulemaking authority to select that database in order to determine the median in-network rate. Changes the definition of emergency services to coincide with existing law. And then it changes from 45 days to 90, the department to resolve any network sufficiency investigations. And with that, Madam Chairman, I'll stand ready for questioning.
Do we have any questions from the members? Chairman Kumar, you're recognized.
Thank you, Madam Chair, and thank you, Mr. Chairman, for bringing this. I know it's redundant, but I once again want to confirm that under this legislation, patient will not be balance billed except for what they owe according to the deductible and copay in their in-pay plan.
That is correct. That is our intention, Mr. Chairman.
That's the most important thing, and thank you for bringing this. Thank you, Madam Chair.
Thank you. Any further questions? Seeing none. All those in favor of sending House Bill 1503 to insurance full signify by saying aye.
Aye.
Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Madam Chairman and committee.
Thank you. Item number 3 is House Bill 1163 by Chairman Todd. We have a proper motion and second. I see that you have an amendment. Can you verify the drafting code?
This amendment makes the bill drafting code 4674.
We've got a motion and second on the amendment. We're going to vote on the amendment. All those in favor signify by saying aye. Opposed? The amendment is on the bill. Chairman, you're recognized.
Thank you, Madam Chair. The Healthcare Sharing Ministry Freedom to Share Act protects access to faith-based health care for Tennessee members of Healthcare Sharing Ministries, HCSMs. Due to their voluntary and ministerial nature, these ministries should be recognized in the insurance code as ministries and not as health insurance companies. This bill is designed so that the state insurance code specifically recognizes HCSMs as ministries and not insurance, and that HCSMs that operate in the state will be subject to the requirements of nonprofit corporations outlined in Title 48 and the requirements set forth by the IRS. Both these safe harbor laws that exist in 31 states now, and this model legislation also is endorsed by ALEC, by the way. Why is it necessary? We want to preserve HCSMs as a viable choice for Tennesseans who are seeking a healthcare solution that is consistent with their religious beliefs. We want to clarify for consumers that HCSMs are not insurance. And we want to ensure that HCSMs are being held accountable to the Attorney General and are subject to regulations. I personally have employed one of these situations in my current company that my wife and I own. This was our primary source of healthcare funding that we had for our family and for our employees for a number of years. Worked extremely well. And one of the side benefits I noticed for the providers is that they generally paid quicker than insurance companies. It works as a sharing type ministry where you pay in a share to the group, and then the group pays your expenses out of that based on certain criteria. So it worked very well. It was a very viable option for us in our small business to be able to operate and continue to offer that type of coverage for our employees and their families. With that, I'll be glad to take any questions.
Do we have any questions from the members? Chairman Lafferty, you're recognized.
Thank you, Madam Chair. Just a curiosity, since you've got firsthand experience, did you notice anything that seemed more affordable about the rates? I mean, it sounds like this cuts out a whole lot of paperwork, a whole lot of administration, and then you're probably, I imagine the provider is aware of your situation and who you're working with. Any comments on that, just as a curiosity?
Chairman Todd, you're recognized.
Thank you, Madam Chair. Thank you for that question. I guess you're probably looking at financial differences, and I'll address that. There are differences if you compare insurance to a sharing ministry side by side. There will certainly be differences. One is usually upfront. Most of these, and the one I participated in, required us to at least affirm our belief in God. Because that was their foundational premise. We had to commit to not consuming tobacco, moderate alcohol, that kind of thing. And that was an agreement each employee had to commit to. And if you weren't meeting that at the time, they gave you a period of time to be coached, and they provided free coaching for that employee to either get off a tobacco product or whatever it may be. Cost-wise, it generally, if I remember correctly, it was somewhere around 1/3 of the cost of a comparable, what you would consider a health insurance plan, something very comparable if you look at the apples and oranges of it.
Thank you for the answer. Thank you, Chair.
Thank you. Chairman Kumar, you're recognized.
Thank you. Thank you, Chairman Todd, for bringing this. I really admire the model. Shows people based on their faith coming together, creating a community in which they help each other. And I think that's admirable and lacking in our society today. I was wondering, isn't there current legislation along these lines in our books, considering that I know the Mennonites and the Amish models, they do similar things?
Chairman Todd.
I'm not familiar with this type of protection that's in our law right now, and that's why I'm bringing this bill, just to make sure it's officially recognized that they're not insurance and that they have the protections and the requirements that are necessary to protect consumers.
Well, thank you. I assume that there must be some protection, but I'm glad if it's not that we are going to accomplish that now. To answer the previous question about financial feasibility or getting a break or a discount, when I was in practice, we did have Mennonite patients who would come in. And since they were going to pay for it themselves, they would come beforehand to talk about the potential cost. And I always had great respect and sympathy and would charge them then less. The question that comes to mind is healthcare can be very expensive. Imagine an open heart surgery or a transplant, and things can be very expensive. In this model, is there, or do you know, or is that being done, that there is a very high deductible insurance to cover for catastrophic expenses?
Chairman Todd?
I seem to remember that there was an underlying catastrophic policy, but I don't want to say that for sure, because that's been probably 4 or 5 years ago that I was in the details of that for our company. I do know that the way this worked, I mean, we would get emails and notifications where people in the group were praying for us. Like if we had a specific medical condition, like my son, right before I was elected, came down with a medical condition that was life-changing. And we had people praying for us and letting us know that. So it's almost like a family type setting is the way this works. And one of the limitations, to go to the question that was previously asked, we didn't have any drug coverage. That just wasn't provided in the type of sharing ministry that we were part of. And with my son's situation, we were facing a potential financially catastrophic situation because the medication that he was prescribed every 8 weeks was going to cost upwards of $30,000. But I had a conversation with the folks in the ministry that were managing this, and they said, we've had one other case exactly like this, and we covered it. Even though I don't think technically they would have had to, but they did cover that. And so it's the decisions are made more like a family would make them. And I really appreciated that. It gave me a different perspective than I had prior to that. And it was very encouraging.
Well, thank you. But once again, you know more about it. And I would put that as a cautionary note that maybe there should be catastrophic insurance on top of this plan. And once again, I admire the model. Thank you, Madam Chair.
Thank you. Representative Mitchell?
Yeah, thank you, Madam Chair. Dr. Kumar had some of my questions, but along those same lines, so this is, as you said, not insurance. And as you said, it was covered. They made the decision like a family and covered that one instance. But will they have standards that if they cover, your son's condition, then will they cover Dr. Kumar's child's condition with the same condition, or they just do it person by person?
Chairman Todd?
Thank you, Madam Chair. There's no way I can answer that for each one of these ministry groups. They each have different policies and procedures. I just was expressing what my experience was, and they gave one other example of how they had made that decision. And since my son was receiving treatment in the hospital, they said that definitely was covered. But it was the 8 weeks after that when he came out was what I questioned them on. And we never got to play that out because I got elected during that same time frame and was immediately eligible to be on the state healthcare insurance program. And so that's what our family opted to do. So I never got to play that out any further to know if they established any kind of policy, but that would certainly be up to each one of these sharing ministries, and they would share those policies with the members because you're literally a member of the organization. And so, you would have access to all of that information up front.
Representative?
Yeah, and as long as, like I said, that one ministry, if they keep that same standard, for what they're covering for everyone is the same instead of, one by one decision making, that would concern me. As well as, like you said, this is not insurance. And, the consumers of the state, you know, if it's not a sophisticated consumer, they could be easily led to believe that this is something that it is not. And I just think, it's our duty to put safeguards in place to keep that from happening. I've run into, a couple of these. There's one in Memphis that works quite well. But I've also ran into several in the industry that have taken advantage of people as well. So just like any other business, you're going to have good ones and bad ones. We just need to have the safeguards and make certain that people aren't taken advantage of.
Chairman Todd.
Representative, you have made my point exactly. That's one of the premises of this, is to make sure consumers know upfront it's not insurance. It is something different, and each one of these ministries would describe to their new member or their potential new member exactly what it is and what the limitations are. And that's what they did with me. So we knew going in what the rules were. And if there were any changes to that, they sent us that well ahead of time. So it operated very well, but this makes sure that that continues in that light.
Representative Mitchell.
Exactly. All right. Just want to make certain that they know, you may be getting prayers, but you're not getting Mayo Clinic.
Chairman Todd. Any further questions? I do believe we have someone here to speak. I think we're going to go out of session without objection to hear from Joel Noble from Samaritan Ministries. Good afternoon, Mr. Noble. You have 3 minutes. Can you please state your name and who you're with for the record, please?
My name is Joel Noble. I'm with Samaritan Ministries, and I'm here from Peoria, Illinois. Thank you, Madam Chair, for having me today. As I said, I'm with Samaritan Ministries. I'm the Director of Public Policy, and Samaritan Ministries is one of 3 of the largest healthcare sharing ministries and a founding member of the Alliance of Healthcare Sharing Ministries. For over 27 years, Samaritan has been serving its members as Christians bear one another's burdens through healthcare sharing, and that includes currently over 8,800 individuals here in Tennessee. I've been blessed to have been serving with Samaritan for over 20 years, and I'm also currently serving as the chairman of the board of the Alliance of Healthcare Sharing Ministries. We support House Bill 1163 as amended, as it will remove any question that may arise in the future by recognizing that healthcare sharing ministries do not constitute the transaction of insurance business in Tennessee. And as Representative Todd stated, 31 other states have already passed laws similar to this. And I just want to be clear that explicitly clarifying that healthcare sharing ministries are not subject to the insurance code does not remove any consumer protection, but rather it will eliminate any confusion to jurisdiction, and as ministries will be subject to the laws applicable to charities enforced by the Attorney General. So let me give you an example, a functional example from my own life of how the ministries work. I've been a member of Samaritan Ministries, as I said, for the last 21 years. I've had a number of needs throughout those years, including the birth of my 4 sons. When we had those maternity needs, my wife went to the doctor and had her visits. We also went to the hospital ahead of time. Our hospital had what's called the Stork Broker program. It was a prepaid program. My oldest son, who's now 20, we paid $2,800 up front. My youngest son, who's now 8, we paid $3,600 for him ahead of time. I turned those bills in, the hospital bill, my wife's bills, to the ministry, and then they assigned other members to send to me directly. I received about a dozen checks in the mail, cashed those checks, went and paid my wife's providers. This is the same for all our medical needs. In turn, each month as a member, my family of 6, we're currently sharing at $365. So each month I'm going to write a check or I may go into PayPal or Venmo, however the other member wants to receive it, and send my share directly to that member that had that medical need. Praying for them. I know exactly what their need is. They're receiving my check along with the other checks or the PayPal to pay their shares. That's how Samaritan works. Some of the other ministries may do that a little bit more sophisticated, electronically, member account to member account. We're a little bit more direct sharing with the checks and PayPal, but it just kind of gives you an idea functionally how these work. So these ministries, like us, do not assume any risk or guarantee payment of medical bills and operate with voluntary cooperation, sharing without a contractual transfer of risk. We also put a high priority on meeting the spiritual and emotional needs of members through prayer and notes of encouragement. So I would just ask that you support House Bill 1163 as amended, which will explicitly clarify the nature of healthcare sharing ministries. So I appreciate your time, and I'm more than happy to answer any of your questions that you still have or clarify if Representative Todd didn't answer it fully enough for you.
Thank
Thank
you.
you.
Members, do you have any questions? Okay, seeing none, we will go back into session. Thank you. Chairman Todd, do you have any further discussion on your bill?
No, ma'am. Thank you.
Okay, I think we are ready to vote. All those in favor of sending House Bill 1163 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to full insurance.
Thank you, Chair, Lady, and
Thank
Committee.
Item number 4 is House Bill 762 by Chairman Eldridge. It has been rolled 2 weeks. Item number 5 is House Bill 607 by Representative Hill. Okay. We're going to roll that to the Hill. Item number 6 is House Bill 425 by Representative Glenn. It's been taken off notice. Item number 7 is House Bill 1309 by Chairman Kumar. Do I have a motion and a second?
Motion.
Chairman, you're recognized on the bill.
Thank you, Madam Chair and members. House Bill 1309 is the Genetic Information Non-Discrimination Act. We do have the knowledge and we know that our mental, physical, psychological, and other physiological characteristics are based on a genetic lottery, depending on the genes that we inherited. It plays a major role in our lives. Now that human genome has been mapped and all the genes in the genome have been identified, that means there is tremendous information available today to predict our behavior, our health, and our future, which used to be unknown. That leads to the point that can that genetic information be used to predict our longevity and therefore our life insurance. Federal government has passed Genetic Information Non-Discrimination Act, but but life insurance is regulated by the states. And this sort of discrimination based on our genetic makeup is prohibited under federal law as well as a law passed in Tennessee in 1997. This particular law applies to life insurance, and that insurer will not deny life insurance, purchase genetic information, require a member or an applicant to go through genetic testing, or access any sensitive genetic data without the permission of the member or the applicant. And these prohibitions will prevent unnecessary genetic information in purchase of life insurance and maintenance of those policies. With that, I'll be happy to answer any questions.
Thank you. Do we have any questions for members? Seeing none, we will now vote. All those in favor of sending House Bill 1309 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full. Item number 8 is House Bill 1318 by Chairman Kumar. We have a proper motion and second. Do you have an amendment?
Yes, Madam Chair, it's 4618.
Do we have a motion and second on the amendment? Your amendment makes the bill, so we will now vote on the amendment. We are voting on the amendment. All those in favor signify by saying aye. Aye. The ayes have it. The amendment is on the bill. Chairman, you are recognized on the bill as amended.
Thank you, Madam Chair. House Bill 1318 is meant to avoid the situation that during litigation, claimant has received settlement check has been sent to the attorney, and the attorney forgets to let the claimant know that payment has been received. So this bill requires the insurance company that when they make a payment for a settlement, that at the same time, they will inform the claimant that a check has been mailed to their attorney.
Thank you for that explanation. Do we have any questions from the members? Seeing none, we are voting. All those in favor of sending House Bill 1318 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Madam Chair and members.
Item number 9 is House Bill 498 by Chairman Martin. We have a proper motion and second. Chairman, do you have an amendment?
Thank you, Madam Chair. Yes, ma'am. Amendment 4040.
Okay. We have a motion and second on the amendment. Chairman, you're recognized on the amendment.
Thank you, Madam Chair and committee. This to issues pertaining to telehealth in regards to physician's assistants. This bill works solely with providers, currently the PA programs. Let me start over. That was not where I was going with that. The first part of this bill addresses physician's assistants that work solely with collaborating physicians within a remote setting. Currently, the bill states, or the law states, that they have to have 12 visits per year. 10 of those can be online or telemedicine wise. This would allow 12 all to be via telehealth virtually with those providers. This would allow to get in coordination with the community health centers and FQHCs, which allow the 12 to be done remotely currently. The second change of this bill would allow an exemption to the 16 months that's already in play, where within 16 months, you have to see them initial visit before you can do a telemedicine visit. So this aspect would allow an exception to that when it's in behavioral health component. So the provider would then be able to see them for the behavioral health aspect and then allow the patient to next visit to be in person. So that's where we're at with that. Any questions?
Do we have any questions? We're going to vote on that amendment. All those in favor signify by saying aye. Aye. Opposed? The ayes have it. The amendment is on the bill. Chairman, do you have any further comments?
No, ma'am.
Okay. The question has been called. Without objection, we're voting on the bill. All those in favor of sending House Bill 498 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, committee and chair.
We are back to item number 5, House Bill 607 by Representative Hill. Do I have a motion and a second? We have a proper motion and a second. Representative, do you have an amendment?
We do. 4258.
I have 4467. What was the number you called?
4258.
4258. I'm sorry, we did not receive 4258.
4467.
We do have 4467.
Okay. And
Is
that
that the
does,
amendment?
that does make the bill.
Okay, we will, okay, we will vote on the amendment. All those in favor of the amendment signify by saying aye. Aye, opposed? The ayes have it. The amendment is on the bill. You can explain the bill as amended, please.
House Bill 607 prohibits insurance companies and TennCare from requiring prior authorization for the repair of power and manual wheelchairs. This bill was brought to me by the Tennessee Disability Coalition on behalf of their members and constituents who have struggled to navigate this burdensome red tape. I will insert here that I have been fighting this myself since the 1st of January, trying to get some new tires for my wheelchair. Had to take some from another chair because I was getting threadbare. So I fully understand this red tape and this burdensome situation. The current requirements for prior authorization are unnecessary, lead to long delays in the repair of equipment and numerous negative outcomes for people who use wheelchairs. These folks rely on this equipment to get around the community, sustain their care, to go to work and live independently. And prior authorization puts a pause on all of those things. This bill would speed up the repair process, allow these people to get back to their lives. This bill targets kind of a narrow window. Basically, the typical lifespan is about 5 years on wheelchair equipment. Most wheelchair repairs in the first 2 years after it's purchased are normally covered under warranty. And then, so we're looking at year 2 to year 5, basically that 2 to 3 year window. Now, this bill does not eliminate prior authorization for the initial purchase or any replacement of the equipment. It is for the repair of the same equipment that has already received prior authorization when it was purchased in the first place.
Thank you for that explanation. Any questions for members? Seeing none. Without objection, we're voting. All those in favor of sending House Bill 607 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Madam Chair and Committee.
That concludes our calendar, but I would like to recognize all the physicians that are here from the Tennessee Medical Association. Thank you for being here and thank you for what you do. Any further comments from members? Do I have a motion to adjourn? We are adjourned.